Has someone ever told you that root canals are toxic or that fluoride is a neurotoxin and you should avoid it? We need to talk about this because there is a growing trend in fear-based dentistry. I'm here to tell you why this is not only wrong, but this is also dangerous. So today I'm going to be breaking down some of these biggest myths that these holistic dentists want you to believe. Now, disclaimer, I'm not saying that all these holistic dentists are bad. And believe me, I know that there could be some bad traditional dentists too. But at the same time, we have to call out misinformation, especially when it's being used to scare you into buying a more expensive product or procedure that you might not even need. Let's start with number one. Root canals. There is a lot of controversy going on, and if you haven't heard about this, there are some holistic dentists online and on social media that you might see that are saying to completely avoid getting root canals. And it's not just holistic dentists, it's other people too claiming that they know more based on whatever research that they saw. One common claim people make is that a root canal will leave a dead, infected tooth in your body forever. So let me just explain what a root canal is in the first place. So typically a root canal is done when you have like a really big cavity, like you have this hole that gets inside of your tooth and then that cavity spreads, it gets bigger, and then it eventually gets inside of the nerve inside of your tooth. The nerve, or in other words called the pulp, is in the middle part of your tooth. And once a cavity gets there, it is just too far gone. The only way to save that tooth is with a root canal, and that's where you basically have to clean out all that cavity, and then you have to disinfect and clean out that nerve because bacteria has gotten into the nerve, into these canals that basically feed that nerve, and you have to clean all of that out in a root canal. And after that's all cleaned out, you have to seal it all off and then protect the tooth. And typically, if it's a back tooth, we'll put a crown over the tooth. A crown is basically something that goes around the tooth, kind of like a cap that covers a tooth, and it protects the whole tooth. Now, a tooth is different from other parts of your body. Like if you had your dead liver and you kept it inside your body, that'd be one thing. Yeah, you probably wouldn't want to keep that in your body. But a tooth, on the other hand, just because you remove that nerve and that blood supply, it doesn't mean it's dead. That tooth is still functioning. You're still using it to chew with, and that tooth is still remineralizing. How do we know this? Because you can still get a cavity on a tooth that has a root canal. And at the same time, you can still remineralize and strengthen teeth that have had root canals before. And that's because the enamel, or the outer part of the tooth when you get a root canal, acts the same as the enamel of a healthy normal tooth. And you also have these ligaments that surround your roots. So these ligaments are what attach your root to the bone in your jaw. And these ligaments are like these pressure sensors. So these ligaments are the reason that you can feel like when you chew and eat something, like you can tell that you're biting into something. Those ligaments are still there and they're still healthy in a root canal tooth. So just because the nerve is gone and the blood supply to the actual tooth is gone, the tooth itself is still functioning and it can still remineralize like a normal tooth. Now, another common argument I hear about root canals is you can never 100% disinfect the bacteria inside of the canals in a root canal. Like, how can you be so sure you were 100% certain that you clean out every single bacteria in there? Well, we're not. Root canals can be complex, and these canals that feed the teeth and feed the nerve can also be complex. And yes, some bacteria might remain inside of those canals, but we're not relying solely on our techniques. This is like any surgery. Like when you do a heart transplant, there's still going to be some bacteria that are involved in that heart transplant. You're relying also on your immune system. It's like if you were to scrape your knee, like you can't completely disinfect it, but you can clean it, protect it, and cover it so that your immune system can do the rest. But what I think would be even more convincing is to just look at some studies. Modern techniques using things like ultrasonic activation, sodium hypochlorite, which is basically bleach, and bioceramic sealers are able to get the canals like 95 to 99% clean. Now, this is assuming that root canals are done correctly. The rest, or whatever remaining bacteria might be there, your body has to do its job. And depending on what study you look at, root canals have a long-term success rate between 85 to 95%. Now you might wonder, well, that's not a 100% success rate, so should I be concerned? Well, nothing in dentistry or in medicine is going to have a 100% success rate. Even like knee replacements have a similar success rate to root canals. So yes, there is always risk involved, and you still might end up losing the tooth. But the goal is to keep the tooth as long as possible. Because unfortunately, the people that completely tell you to avoid root canals don't really have better solutions. Because if you were to take out the tooth, now you have to go through a surgery where you have to put trauma to your body. And then when you take that tooth out, now you can get bone loss and your teeth can start to drift. And it's kind of like a domino effect where you might start to lose other teeth on that side. And then this can slowly affect every single tooth in your mouth. When people say you should never do root canals, they commonly cite studies from someone named Weston Price. Now he had some good points, but the only problem was these studies date back to the 1920s. That's over 100 years ago. And you might see some other claims like people saying like, oh, I have a root canal and I ended up getting cancer, or I had these other systemic problems. Well, there's two problems with that. These are all just correlation. And these are all anecdotes. This is the weakest level of evidence we could possibly ever find. And if we were to start practicing dentistry and medicine like this, things would be a lot worse. It would be like saying that ashtrays cause cancer. We know that smoking causes cancer, and we know that people who smoke probably have an ashtray to put their cigarette. But if you look at correlation, it would look like these ashtrays are correlated with cancer. So therefore, these ashtrays are the reason that you have cancer. It's the same logic. It doesn't make any sense. Now this actually brings us to number 2, which is talking about implants. Look, I'm a big proponent of implants. Like, I think they're a great option if you have no other option. If you have to lose your tooth, an implant is a great option to replace it. Now, what is an implant? An implant is a screw that goes into your bone to replace your tooth. So the screw that goes into your bone basically acts as your root, and then it locks into your bone, and then when you put your tooth on top of it, it's like you have a brand new tooth. Now a lot of people that don't want to get a root canal, they end up getting an implant, and I think that's a great option. I'm not saying you have to get a root canal. I just want to make sure you make an informed decision. But one trend I see is that people who say that you should not get root canals also say that you should not get metal implants. So typically these implants that go into your bone are made out of titanium. Now these titanium implants are nothing new in dentistry. They've been used for many years before they were used in dentistry, like in knee implants or other implants by orthopedic surgeons, and they had really good long-term success in other parts of the body. So why not try it in the jaw to replace a tooth? And heck, it worked really well. But if you listen to some of these TikTok scams, they'll tell you that you should avoid titanium implants and only get a ceramic zirconia implant. The claim I hear a lot of times is that this titanium, this metal is bad, and if it gets inside your body, it will leak and then it can make you sick and cause all these systemic illnesses. Kind of like if you leave a root canal inside of your body. Now, just like these claims about root canals, there is no evidence of any of these claims. In fact, all evidence about root canals and about these titanium implants show that they are actually very safe. Titanium is extremely biocompatible, and there are many years, like over 30 years of high quality data to show this. Now, am I saying that you cannot get a zirconia ceramic implant? No, you still can. It's just not as good. Zirconia is actually a little bit more brittle and it lacks more long-term studies. But in some cases, you might have to get a zirconia implant. And the only time I would tell you to do this is if you have a titanium allergy or a metal allergy. This is extremely rare. I think the last study I saw was 0.3% of the population has this titanium allergy. But if you're one of those people, then you should probably get a zirconium implant because you don't want to put the metal inside your body. And again, with titanium implants, also really high long-term success rate. Like after 10 years, most studies show a success rate of 95% or higher. So if I had to get a dental implant, I would 100% want to get a titanium one. But if I couldn't do that, then I would still settle for the zirconia. But please don't let anyone scare you into avoid getting a root canals and then avoid getting a titanium implant and then force you into getting a zirconia implant, because now you're getting scammed. The third dental scam I want to talk about is fluoride, specifically anti-fluoride people. This one is really common, and you might have heard this from either RFK or from TikTok. But either way, the claim is that fluoride is a neurotoxin. Now, within this fluoride neurotoxin community, there's some people that say that they completely want to avoid fluoride altogether, like don't want it in my toothpaste, don't want it in my water, etc. And there's some people that say that it's okay topically, like I'll be okay with it in my toothpaste, I just don't want it in my water. Now, for this video, I'm really going to focus on fluoride being used as like a topical agent, like in toothpaste and stuff like that. The claim I hear a lot is that fluoride is bad for you for one reason or another, and they point to some random study where it's like some correlation showing that fluoride will lower your IQ, and that instead you should use a hydroxyapatite toothpaste. Now, if you haven't heard of hydroxyapatite, your enamel or the outer layer of your tooth is actually made of these hydroxyapatite crystals. They're basically these crystals that are held together, and the goal of the toothpaste, whether it's fluoride or hydroxyapatite, is to strengthen and remineralize your teeth. By remineralize, I mean basically swapping out these old minerals and putting in and depositing new minerals to keep your tooth strong. You see, as we keep remineralizing and strengthening our teeth, it prevents cavities from forming, and it makes sure that we constantly constantly have a good supply of minerals so that we don't lose enough minerals, because if you lose too many minerals, then we can get a cavity and our teeth can get weaker. So the whole point of fluoride is that it actually strengthens your teeth. It makes your teeth stronger than your hydroxyapatite. So when fluoride gets in contact with your teeth, it'll actually swap out the hydroxyl ion and replace it with the fluorine ion. And now these enamel crystals are no longer called hydroxyapatite, they're actually called fluorapatite because of the fluoride, and they're held tighter together. They're more compact. And all this does is it basically makes your enamel stronger. It makes it harder to basically break away when it's all compact like this. So typically your enamel or your hydroxyapatite will start to break down or demineralize and form a cavity at a pH of 5.5. So your enamel will form a cavity or form a hole in response to acid. Your teeth do not like acid. Now fluorapatite, or when your teeth have been exposed to fluoride, they'll actually start breaking down at a pH of 4.5. So now you have to get something a lot more acidic in order to break down a fluorapatite crystal. And this is the benefit of having fluoride on your teeth. But the claims that fluoride is a neurotoxin, or fluoride can lower your IQ, or fluoride can do all these other things, there is no actual evidence behind this. There might be some correlational data showing that communities that have a ton of fluoride in their water are actually more likely to have lowered IQ. But the studies that I've seen, there's actually many problems. One, for example, the sample size is super small. Like, people will point to studies that have like 50 people in a community. And two, the levels of fluoride are way higher than what's regulated in the US. Now, am I saying that fluoride cannot be harmful? No, obviously not. Fluoride can be harmful just like any other medicine. But the thing is that the dose makes the poison. And I actually made another video kind of diving more into deep on this, so I'm putting a link in the description below if you want to learn more about that. But essentially the levels in our toothpaste are so low for like a 150 pound or 70 kilogram adult, they would have to consume like 3.5 tubes of toothpaste just to get sick. And that's like at the lower end of getting sick. Like, some studies show that you have to consume like 7 tubes of toothpaste for that adult just to get sick. And for that adult to potentially die, they would have to consume like 22 tubes of toothpaste. And keep in mind, this is all just in one sitting, like not just like spread out through a lifetime. So obviously you can find some mechanisms or some correlational data out there to kind of back up any claim that you have, right? But you really have to take the time to look at all the data. And this is the problem with social media, is that it's really easy to cherry pick like 1 or 2 studies and highlight some correlation here and there and kind of neglect the other important parts of the study and make something seem really scary. And the reason I'm telling you all this is not because I'm totally against hydroxyapatite. I think hydroxyapatite toothpaste is fine, but I think it can be a big scam, and it's really easy for you to get scammed into buying something that won't even work. And I'm saying this for a few reasons. First of all, fluoride is backed by many years of research, like almost 100 years of research. So in my opinion, fluoride is actually safer than a hydroxyapatite toothpaste. And you might think like, well, hydroxyapatite is actually what's making up our teeth, so shouldn't that be safer? Well, first off, the studies about fluoride show that it's actually safe. Now, hydroxyapatite doesn't really have as many studies, and the hydroxyapatite in your enamel or in your teeth is not the same hydroxyapatite in that toothpaste. The hydroxyapatite toothpaste is still made in a lab, it's still synthetic. And we don't have as much research on this hydroxyapatite toothpaste right now. Now, keep in mind, all the studies so far have shown that it is safe. So I think it's fine, especially for people that don't want to have fluoride. You know, it mimics the natural tooth structure, it can still remineralize your teeth, but it has to have a couple specifications. In order for this hydroxyapatite to actually work and remineralize your teeth, it has to be nano size, so it has to say nano hydroxyapatite, and it has to have at least 10% in that toothpaste. If it doesn't meet those 2 qualifications, then the toothpaste that you're buying, you're just gonna be wasting your money on. Because a lot of toothpaste companies, they'll say like, oh, micro-sized hydroxyapatite. But micro-sized and nano-sized are different. You need that toothpaste to say nano hydroxyapatite. A lot of these companies will just try to get you to buy this product because this micro hydroxyapatite is a lot cheaper. And then instead of putting 10% in there, which costs a lot more money, they might just put like 5% or 3% in there. Because they're assuming that you're not gonna know. They're assuming that you're gonna get scared from this fluoride ad or this anti-fluoride ad and then be forced into buying this natural hydroxyapatite toothpaste that you think is actually going to be better for you, when actually you're just spending $40 or $25, whatever, on a toothpaste that's not really doing anything. So again, I have nothing against this hydroxyapatite toothpaste, but I don't want you to waste your money. If you're going to spend that money on a toothpaste, make sure you see nano hydroxyapatite toothpaste and make sure you see 10% in that toothpaste. Otherwise, just stick with the fluoride toothpaste or just don't waste your money on remineralizing toothpaste at all. All right, on to number 4. The fourth scam or myth I want to talk about is about silver fillings or amalgam fillings. Now, I've seen a couple different scams like this in the dental world. Some people say that if you have silver fillings, you need to get them out immediately because they have mercury, and that mercury is basically poisoning you. Now, other holistic dentists might talk about things like ozone therapy or all these things to basically safely remove these amalgams. Otherwise, traditional regular dentists who remove these amalgams might actually be harming you. Well, here's the reality. These amalgam silver fillings do contain mercury, but there's different types of mercury. The mercury in amalgam is actually called elemental mercury. This is not the kind of toxic mercury that's found in fish. Now, can it still release mercury? Yes. So if you have, for example, a silver filling in your mouth, it can release mercury in the form of vapor. So if you're like chewing on food and all this stuff, everything throughout the day, what studies show is it can release about like 1 microgram of mercury a day. That's for one filling. Now, on a typical day, just from food, water, just living, we're exposed to about 110 micrograms a day from mercury alone, without including any silver fillings. And what studies even show is like even people who have like 18 silver fillings, they did studies on people who have 18 silver fillings. That's like pretty much every single tooth in your mouth has one of these silver fillings. You're exposed to an additional 20 micrograms of mercury in a day. And again, you're comparing that to the 110 micrograms of mercury you're exposed to on a day-to-day basis already. And the other thing to look at about mercury, especially this elemental form from these silver fillings, is how it's actually bioaccumulated in your body. Like, how is it actually absorbed? Well, it's not absorbed well. Most of this mercury is going to be excreted through your urine or your feces, and even from like your hair, your skin, or your nails. So a very small amount of it is actually going to build up in your organs. The type of mercury that you want to be most scared of is like organic mercury. And this is what you get from like fish, and this is what can actually build up in your body. Now, the other thing to note about these silver fillings is you get most of that exposure to the mercury at the time of the placement of the silver filling and the time of the removal. So if a dentist is telling you to remove all your silver fillings because of mercury, just know that you're going to be exposed to a lot more if they remove that filling versus if you keep it in there. Now, sometimes people talk about these like safe removal practices, like you'll see these like holistic dentists talk about like doing like ozone therapy and all these other things, which are going to cost a lot more money than traditionally just doing a filling in a dental office. Now, if you want to do this safe removal, that's totally fine. But I don't want you to be scared into it if you can't afford it. Because again, the mercury from the amalgam is not really absorbed very well, and it's such a minimal amount that it doesn't really reach the threshold to even cause like subtle effects to your body. Now, that being said, I don't personally place silver fillings anymore. The only time I ever did it was in dental school. I think that there are better options out there that look more aesthetic, and obviously like if you can avoid being exposed to any type of mercury, that would be better. But if you're watching this and you have some silver fillings and you're wondering like if they're causing any problems, they are not. So those are some of the main kind of fear-based scams I wanted to talk about. And you'll notice a common trend. They're all trying to scare you out of doing something or into doing something else. Like trying to scare you out of doing a root canal. They're trying to scare you out of doing a titanium implant, trying to scare you out of using a traditional fluoride toothpaste that costs like $1 or $2. Or they're trying to scare you to spend like thousands of dollars to get all this other therapy to remove a silver filling, which you might not even need to get removed in the first place. The other thing that they tend to do is they cherry pick data. They might use anecdotes like a TikTok comment or a YouTube comment to back up their claims, or they might cherry pick some random correlational study and say it as if it's a fact. If someone is trying to sell you on fear first, and then they're trying to upsell you something that costs a lot of money, but you feel like you're being forced into buying that, I would definitely be a little cautious. Not everything in this world is a scam. Most dentists do mean well and they want to treat their patients the right way. And I think all this stuff and all these scams out there are actually really dangerous because it's building more mistrust with dentists. Like dentists already have a hard time building trust and rapport with their patients. And now people might be seeing all these things on TikTok thinking that their traditional dentists might be trying to scam them when really it's the thing on TikTok that is actually scamming them. Now, just a few other myths out there that you should totally avoid. So one, charcoal toothpaste, don't use it. It's actually gonna just end up making your teeth look more yellow because it's gonna wear down your enamel. Two, oil pulling. I don't have a problem if you do oil pulling. I just don't have time to spend 20 minutes swishing oil in my mouth and then spit it out, and you can't even spit it into your sink because then it'll cause problems. So spit it in the trash can. I just think it's a waste of time. And then you still have to brush and floss after, because if you use that and replace brushing and flossing, then you're gonna have some problems. So in a nutshell, what I'm trying to say is I don't think everything alternative is bad. I think there's some good alternatives out there. And I don't think everything controversial is perfect either. Like I don't think root canals are perfect. I don't think anything in dentistry or medicine is perfect. But what some of these people who claim to be holistic realistic dentists on social media are claiming is not perfect either. Like, I don't think a ceramic zirconia implant is going to last as long as a titanium implant. We just don't have the studies to back it up. So when in doubt, if someone is trying to use a scare tactic, just take a step back, maybe get a second opinion, and then go from there. Anyways, if you guys haven't already, make sure you hit that thumbs up button and subscribe to my channel below. And I will see you guys in the next video. One thing I think we all know is that if you do not brush your teeth, they're probably gonna start rotting and then fall out of your face and you're gonna end up in dentures. But this guy may have solved that problem. So this video came out like a year ago and you've probably heard of the guy. His name is Brian Johnson. He's basically this multi-millionaire tech guy who is spending millions of dollars